Hello, everyone. This is Dr. Judy Shaw with Shaw Medical Travel Consultants, and I want to thank you all for joining in with us for another one of our talks today. And today we're focusing on the Latina women, female concerns with regards to the healthcare industry experiences in the United States. And so I have the pleasure of introducing Senora Mirian Cruz, and her daughter, who is a nurse, Lorena Cruz, who is also a part of Shaw Medical Travel Consultants. And so we're going to be speaking in a combination of English and Spanish, but we're going to make sure that all the information is adequately understood. So, hi there, how are you doing, Lorena, and how are you doing, Senora Cruz?
Hola.
We're doing fine, thank you. How are you?
All right, doing fine. Have you had, Senora Cruz, have you had experiences within the healthcare arena here, healthcare system here in the United States? Have you had need to go and see doctors or the hospitals or healthcare industry for whatever reason? So just take a brief moment to sort of explain to us what your experiences have been.
Okay.
Pues mi experiencia durante el tiempo que he estado acá en Estados Unidos, pues en esos tiempos casi no podía, digamos, tomar un seguro por muy costoso, pero para mí es lo mejor es agarrar una aseguranza, que hubiera una aseguranza médica para todo el ser humano. Es mejor.
¿Usted tuvo obstáculos accesando servicios médicos? Por ejemplo, su lenguaje, ¿usted no sabía hablar inglés?
Oh, pues sí, eso sí, se batalla a veces un poco porque no hay intérprete y no todo el tiempo hay intérprete y tiene uno que, pero sí, en eso sí se batalla.
So at times when she went on her own, she did not have anybody there to help to interpret?
Correct. Those are the obstacles that she came across in the beginnings of her being here with the medical services. Is just an obstacle where language barrier was one of it.
Okay, that's a major thing. And while the times that you were able to communicate, well, let me back up there. So during this time that there was difficulty communicating, okay, with the medical facilities because of the language barrier, well, how were your needs met?
Pues siempre teníamos que buscar un intérprete que nos explicara qué es lo que decía los papeles para que entendiéramos, pero con al intérprete siempre.
So every time she would have to, either the service provider would have to provide an interpreter, or she would have to search for an interpreter herself to be able to understand what her services, her rights, or the recommendations were when she assessed medical service.
And thanks for that explanation. And did you, because you had to go through an interpreter, did you shorten your complaints? I mean, if you were talking to someone who understood the language, like, you know, maybe between you and your daughter, you didn't have to stop and think, okay, you know, maybe I won't bother to say that because it's too complicated. Were you able to freely share? Did you have all your needs met, or did you have to just sort of keep it short?
No, simplemente me explicaban lo que no entendía. Ellos me lo explicaban en español, en inglés, en español.
Okay. And so things like medications, that, you know, I'm assuming if there were medical conditions that she's being treated for. So things like medications that the doctors were giving her, was she completely, obviously you're a nurse, Lorena, so I'm sure you helped her a little bit, but, you know, before consulting with you or reviewing things with you possibly, did she understand what she was supposed to take and why she was supposed to take it and what it was for? Did she feel that the doctors, even through the interpreter and the nurses, the team, did she feel that they explained her conditions and or took the time to go over whatever it was she had and what it meant and what probably could be the prognosis down the line and the medications and treatment that she needed to do? Did she have a full grasp of that leaving the office? Or did she have to call you and say, I don't know what they said, Lorena, help me?
Yeah, good question. Yes, I can tell you that myself, but
no.
So siempre usted ha ido y si le han explicado bien,
Sí.
No ha tenido preguntas o...
No, problemas así no. Siempre ha sido de lo que han recetado y todo, era bien.
Pero generalmente usted sabe más o menos por qué fue, cuál era su diagnóstico y cuál era su tratamiento.
Sí.
Okay, so she says in generalizing that she, you know, going to the doctor, she did understand or understood her prognoses or her diagnoses and what the recommendations were. But I do tell you, as her daughter and being in the medical field, I would have to elaborate or explain into more detail as to, you know, why medications were prescribed or, you know, why she was treated the way she was, into more of in depth for her to understand.
Okay. So there was a little bit of lack of communication, maybe there, lack of understanding that she had. So possibly if you weren't around to help her explain these things, there could have been miscommunication, misunderstanding.
Correct, or clueless.
Yeah. Okay. And for example, you know, if she had to go to the hospital or to get an outpatient procedure and find her way around the hospitals and to go here and there, and how easy was that? Or did you all have to go with her in order to help her figure out where she was going? Was there adequate people to help explain to her? Did she have any experiences in that arena that she needed to get your assistance or maybe some of your other family members' assistance that she wasn't able to navigate the system herself?
Yes, I could help respond to that question. So yes, you know, there has been an experience where she was giving an outpatient imaging test first, you know, clueless. She didn't know who to call or where to go or where to schedule the appointment. So I had to intervene. As we all know, with insurances, there's in-network or out-of-network benefits that in most cases, we don't know what those things mean. So, so me initially working in the medical field, I had to help her, you know, arranging those things, making sure we reach out to the facilities that do accept her insurance, you know, schedule appointments, you know, all the questions that she needed to answer, I needed to help her to make sure that this test was actually being done appropriately.
Okay.
So yes, I had to.
That was an issue.
Correct, yes.
When she, and now this may be a little sensitive, but so when she did not have insurance, when she was not covered, as she mentioned in the beginning, sometimes when people aren't covered and they may or may not sometimes have, you know, healthcare is expensive. So no matter, you know, how much money you have in the bank, a lot of times you still can't afford it, right? Because it's more expensive than most of us can afford. So when she didn't have insurance, did she feel bad? Did that make her feel any way about herself and about her abilities?
Okay.
Sí,
Sí.
sí.
Y en ese tiempo, ¿usted cómo se sintió?
Pues se siente uno mal porque no puede, no tiene seguranza y no puede hacer lo que uno quiere, pero
No tiene muchas opciones.
no hay opciones y tiene que ir sin seguro.
Yes.
Seguro y sí es necesario una aseguranza.
So yeah, she has experienced a situation where she did not have insurance and where she's at an emergency situation where she has no option but to seek medical emergency care, realizing that she cannot afford that, and realizing that she can bear a big bill as such, and be in considerably large debt. Yes, she felt bad. She says she felt bad. She felt less of a person, per se. And for her to go through that, it could be traumatic. It could be traumatic. It could be something that could change a person's life.
I can understand that. I appreciate her for sharing that. Did she not seek adequate medical care sometimes because she didn't have insurance? Did she just sort of try to deal with it at home, or just try to get past it? Or if obviously an emergency is an emergency, but did she delay going to the doctor or seeking attention rather, because of that?
No, yo siempre iba.
Pero ahorita sí, ahorita que no, por ejemplo, no teniendo aseguranza o seguro, usted se ha visto en una situación que, pues por esa razón no puedo ir al doctor, por esa razón no puedo recoger mi medicina, por esa razón no puedo pedir los servicios que me han recomendado. Sí.
Sí.
Sí. Yes, she has had situations where, because of insurance or resources, she's not able to continue therapy or prescriptions or follow-up appointments. Yes, of course. Yes, she has.
All right. Thank you for being honest. And I'm sure that has weighed heavily on her, psychologically, mentally, and obviously physically. I'm quite sure the repercussions of that. Okay. About a diet, for example. If you go to the doctor's office or in the healthcare environment, again, obviously we all have our own cultural habits and our traditions and foods and spices and whatnot that we're used to. So when you go to the doctor's office or in the healthcare industry, and the doctor says, you have a condition, and so here is a diet that I would like for you to follow. How did she interpret that? And is that something that was easy for her? How did she manage to do that?
Para usted no hay problema en eso. Usted no siente que es dificultoso cambiar eso.
Para mí no.
So usted puede ir sin comer una comida por largo tiempo y es fácil para usted.
Para mí sí.
Es fácil. She says she has had an experience where they recommend to either cut or change or modify her diet. She says it's okay. She has been able to change her diet.
Sí, es necesario.
If it's necessary.
Es necesario. Sí, no.
So would she have, a lot of times we use very standard diets. Nowadays, sometimes I do have diets that are, more in line with certain cultural differences. But did she did not find it was difficult to, eliminate possibly certain foods and certain things that she normally would eat in order to conform with whatever this diet dietary recommendations of the doctor was. She didn't find any issues with that.
Usted, por ejemplo, nosotros como hispanos comemos mucho arroz, muchas tortillas. Usted sí ha tenido que es dificultoso. Usted no deja las tortillas 100%, porque uno se acostumbra a comer tortillas, pan. So I've mentioned to her, reminded her that with our culture, we're Central America, you know, we eat a lot of rice, a lot of bread, a lot of tortillas. So it is difficult for us to change that. We're accustomed to eating certain foods because of our tradition, our culture. And yeah, it's difficult for us to let those things go because we're used to it.
Would it be easier if a diet was given to you that was more in conforming with your dietary habits? For you and your culture?
Yes, that's that would be a lot easier. Yes, that would be something.
Sí, porque ayuda.
Okay.
Yes, that would be very, very helpful to accommodate or in our ways, in our what we know, what we grew up with. Yes.
Okay, excellent. Thank you. I'm going to shift gears and ask a little bit about pregnancy. So, you know, the stats for minority groups as it relates to maternal death and death in childbirth and the delivery of the newborn can always be a little bit problematic for a lot of reasons. Some of those reasons being access, you know, not getting to the doctor, not having the adequate doctor care, you know, whether it be your regular social determinants such as transportation, or whether it be finances, or what have the reason or even beliefs. Can you give, and Lorena, if you have any as well, or any other members of the family that you are aware of that may have had, how has your experience been as it relates to the whole pregnancy experience, prenatal care, the delivery, aftercare, after the delivery, and that sort of thing? What have your experiences been?
Well, my personal experience, I was pregnant really early age. So with pregnancy, all in general, it was pretty scary at first. And seeking medical health, prenatal care, was something so new that I had to learn as I went. With the appointments, you get evaluated or examined for the amount of time that you have with the doctor or nurse practitioner. They do give you material to go home to review, to just do your research, or to just know what your time is. Being in a low income household, it was pretty tough per se. I did not have the reliable transportation to go to my appointments. So either I had to miss appointments or have them postponed for a later time. It wasn't something that I could just up and go the next day. It had to be postponed either a week later or a number of days later. So with that being said, it was a really learning experience as I went. With all the risks that comes with pregnancy, seeking or going to my appointments kind of did give me more of a relief, because I did feel that I was getting the care that I needed for my child, and as well being so young. Until the delivery, I had to have both C-sections, and that on itself, it was pretty intense, even the aftercare. But luckily, I'm healthy. The children were healthy. And so I'm just glad that my experience was a good one.
Excellent. Now, and I'm glad too. Now, about something that you mentioned. So so obviously there was difficulty with regards to the prenatal care for the reasons that you mentioned. And as well with prenatal care, there's always recommendations about foods and eating and diet and exercise and drinking and liquids and that sort of thing. Either from your personal experience, your family, your mother, whomever else, was that a part of things a challenge at all? That I mean, again, drawing from experiences may not necessarily have been your personally, but experiences, is that sort of thing, complying with those kinds of things, a challenge at all?
Yes, yes, it is. It is. Because you're used to your own ways, your own, how the way you are, your culture, until, it takes for a situation like prenatal or pregnancy for you to realize that you may need to adjust some things or change some way of lifestyles to not only help you as the mother, but also your unborn child. Right. So yes, it could be difficult. It can definitely be difficult. And I've have had friends that they have to seek for intense care, intense therapy to make sure that they do those changes for the
Thank you. And did you feel, I mean, I think you said that you were happy. So so you felt like you and your other family members, possibly, you felt that you all got you were seen regularly, and the folks, the people in the healthcare arena were attendant to your needs and were listening to your needs or complaints or concerns, or adequately. You didn't feel and again, maybe not necessarily you personally, but anybody else in the experiences that didn't feel like they were pushed off, or not necessarily, their concerns were not taken seriously or taken to heart if you had any concerns or issues?
Yes, I've heard stories. I've had family members that have had stories or situations or experiences where their concerns weren't all addressed, or their questions weren't answered, or they just did not have the relationship with that professional that they feel continuing services from from the facility or from the provider. I've had so many people come to me to let me, to inform me of what their experiences were and what my recommendations were, or what I thought about their experience. And some of the times were not good ones, and we just we pull back. We say, well, if you don't feel comfortable, we need to figure something out. Something has to change.
Yes. Okay. And lastly, I want to ask, if your mom or you, now you're in the healthcare arena, so you may be a little biased, but your mom or anyone else who has had experiences, what would need for you to feel for her to feel comfortable, even when she did not, I know she has insurance now, but when she was not insured, and then, and even now, and any other persons who may have had experiences, if you had to tell the doctors and the nurses who are learning now, and even some of the old guards who just may not understand, that there's this thing called implicit bias, okay, where they don't necessarily, someone may not necessarily see you in the capacity and the whole picture that you are, okay? So if she had to teach medical school for a day, and she had to right a wrong that she feels it is a wrong, at least, what would be some of the things that she thinks that doctors must have and nurses in the healthcare, they need to change in order for her to feel comfortable then when she wasn't insured, now in the healthcare environment?
Pues opciones para poder tener un seguro, pues porque eso es muy costoso, el chequeo de salud, todo exámenes que necesitamos hacernos, eso cuesta mucho dinero y obviamente tenemos que tener un seguro. Es muy bueno.
So yeah, she recommends for everyone to have the access to have insurance to be able to seek services. She would want for everyone to have care, medical care. Yeah.
And I have two other questions. So what do you feel, Lorena, you obviously, again, you have an education in the system, but you know, there are folks who don't. So what is and your mom too, I'm curious her opinion. What is the value of education? Those who are educated and those who may not be educated, how much does that impact you, in your opinion? How much does that impact the ability to navigate the healthcare system?
In my personal opinion, the impact is significant. It's extreme. It's big. It's very big. Educated and not educated. Educated, we see more. We understand more. We hear more. I feel that with education is very important for people to understand what the steps are or how things work, what everything perceived. In my personal opinion, yes, it's a big difference. And it's very important. Education, it is very important. Usted dice o qué cree del valor de una persona educada contra o versus una persona no educada. Hay una impactación muy grande cuando una persona no es muy educada contra la persona que sí es.
Claro que sí.
Yes, she agrees.
Sí.
And then there's this thing called food insecurity, okay? And again, this may not have been your personal experience, but maybe you have friends who, you know, neighbors, family, friends, or whomever, who may have had similar experiences. Food insecurity means that you may not be able to always get your hands on adequate food, nutritional food, at a consistent and regular, on a regular basis. Whether that be for school, whether that be for elderly people, you know, that may live alone, shut in, you know, whatever the reasons are. Have you had, and do you know any that sort of problem or barrier to adequate care within your, you know, anywhere, within your area, within your neighborhood, friends or relatives, cousins, or whomever, people that has impacted, and if so, how and how badly?
Muy difícil, sí. Cuando no hay comida, hay que batallar para buscarla. Sí, se batalla.
Yes, there has been experiences in the past, or either oneself's experience or from others, yes, that they have had situations where there is no source of food, and it's tough, and including with children, families having to search for resources or going out to the public health to seek for food because they don't have the food or the supplements for the day. And it is tough, not only tough physically, but mentally, just not knowing how are you going to eat, what are you going to eat, for that moment being, and just imagining the next day or the following,
Right.
it's very, it's a traumatic event, I feel.
Yeah. And I'm sure that impacts your health and how you approach your visits to your doctor. If you can't get your foods, how are you going to explain this? Do you feel comfortable explaining these difficulties to your doctor and your doctor's environment? I mean, I don't know if your mom had experiences. Do you feel comfortable discussing that at all with your doctor's experience? Or is that something that you prefer to keep to yourself?
Pues no he tenido gracias a Dios, pues hemos tenido el alimento, pero para mí digo que es difícil esa situación.
We both can't imagine.
Okay. Lastly, and so would there be value to in your community where you live? I mean, do you feel that there's adequate education, healthcare education, whether there be educators that come in your neighborhood, whether they're, the church is involved or community center or whatever, but do you feel that there is adequate information that reaches you and the community to tell you about blood pressure and cancer screening and diabetes and all these other medical conditions? Do you feel that you get the information that you need in order to do these preventive services? Do you feel educated enough by whomever, the cities? Is there adequate information that gets to you to educate you as a community about what medical services you should tap into, what you need?
We both feel that it has come a long way. Whatever information there is, it's very limited. It's generalized. It does not, either because of the resources, but it doesn't elaborate in depth. And so I feel that there's so much information out there that is not being put upon the public to where folks are being or are being self-educated in that way to know that there's such a thing. So there is information out there, but it's limited. And if there is information out there, is certain areas that it does not get to everybody.
So this education would help to know, for your mom, for example, to know when she needs to get her mammogram, when she needs to get her colonoscopy, when she needs to, if it's indicated to get a pap smear, all these things. Does she feel that she was educated enough? Somebody told her that these things, you're this age, you should have this, you're that age, you should be getting this. And does she feel she received the adequate information for screening?
Sí, usted le han dicho, ¿quién le han dicho? ¿Su doctor, su familia, o cómo usted sabe?
Doctores, y pues uno en las noticias que le...
She says that either she gets it from her doctor or from the news
de que hay que hacerse este examen y el otro. Nosotros pues las mujeres ya como yo.
So en las noticias?
Sí.
Yes, from the news sources, information is, to get your physical, your mammogram, your annual exams.
So she goes to the doctor and she says, I want to get my mammogram.
Yes.
And that sort of thing, because she's heard it. Okay.
Yeah.
All right, good. Okay. All right. Okay. Well, this has been very, very enlightening, and this has been very helpful. And I want to thank you, Lorena and Senora Cruz.
Okay.
Thank you. Thank you for having us.
Thank you.
Gracias.
Gracias.
And thank you so much. I appreciate it. You look wonderful.
Thank you.
Thank
you too.
All right. So we'll talk to you later. And thanks again. This is
Thank you.
This is Dr. Shaw with Shaw Medical Travel Consultants, and we would like for you to click like on this video if you found it very interesting and informative. Thumbs up for like, and also subscribe to our YouTube channel because we have these and other very informative videos that will be coming your way shortly. So again, thank you, Lorena, and thank you, Senora Cruz.
Thank you. Bye.
Bye-bye.